I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. Welcome to another episode of Women's Health Unplugged. We are going to focus today talking a little bit about self-advocacy. Actually, we're going to talk a lot about self-advocacy and talking a little bit about fertility. So whether or not you are on a fertility journey, whether or not you're on a health exploration journey, trying to learn more about your health, I actually think this episode is for you. When I first asked my colleague, Dr. Moira Kwok, to join me on the podcast today, I said to her, let's talk about fertility. This is something that we both do. This is where her, expertise and skill set lies. I wanted to have a conversation about it. But the more that her and I spent sharing our stories together, talking about our experience navigating the world of fertility ourselves as women and as patients, I realized that this conversation is actually much more about developing self-advocacy skills and learning how to navigate the medical system, regardless of your reason for needing medical care. So, without further ado, thank you so much, Moira, for spending time with me today.
Thank you for having me.
I want you to kind of walk us through your story because your story is so unique. But I also, every time I hear it or hear aspects of it, I see parts of my own story and myself in it, right? And it's like the moments of fear and uncertainty and like the emotion that you experienced through your journey through infertility. I think is something that every woman can really relate to. But I would love if you could kind of walk us through how we got to this point, right? Both personally and professionally for you to support women and couples as they move through fertility.
Sure. I guess I'll start with my own story. I got married in 2013, and like most other people, just assumed we would just eventually try and get pregnant and everything was fine. And particularly because I am a naturopathic doctor, I figured, yeah, I got this. We're good. And didn't really think anything about it until months later. We finally got to actually, charting everything and scheduling everything and all the things coordinated. And it was still every month was a negative, negative, negative. So eventually I was like, okay, I need to find some help. Got into a fertility clinic, and that's where everything kind of got started. Started at one clinic, ended up going to another clinic, opted to do an IUI, which I was actually really resistant to doing anything at the beginning because I was like, I don't need this. We just need to figure out what's wrong and I can fix it. But we ended up doing an IUI and then everything went completely sideways. I had a super rare situation happen where I ended up in the ER a couple days later. Everyone thought I had a really bad case of food poisoning. It was not. Sent home ER number 2, nothing. They couldn't figure out what was wrong. I was actually prepped for the OR because they thought it might be my appendix. Eventually sent home again after a week being in the hospital. And then finally, a week later, I ended up in the hospital again because I had a full obstruction. So apparently, at that point, we discovered that the IUI had caused a pelvic infection that led to the development of an abscess that grew and grew and grew around my digestive tract and just basically choked it off. So they had to put in a drain. Anyways, it was like a 6-week thing that kind of hung out of me. It was super cool. And then it led to me having to go through IVF because I ended up having to have a surgery to remove both of my fallopian tubes. Discovered that I finally had a firm diagnosis of endometriosis at that point, and then continued with my IVF, which resulted luckily in my son, who's now 2 and super busy. But that whole story showed me how important it was to voice like my wants and needs from a healthcare standpoint, even though I am in healthcare. Um, yeah, I guess we'll talk a bit as we go, but that's sort of where my story started and sort of ended, I guess.
It's such a remarkable story because like for so many reasons, right? Like, I think your journey at the beginning sounds like so many couples journeys where they assume that everything's going to go beautifully from a fertility perspective,
Mhm.
or that you were even really sort of resistant to jumping into doing treatment right away. And what was that resistance? Like what made you go like, I mean, what were you resistant about? But then how did you decide to do the IUI in the first place?
I think I was resistant for multiple reasons. I was resistant because I'm a naturopath and I figured I was like as healthy as you could get and I could do this. And resistant because all the medications and that was just a big mountain for me to get wrap my head around. And we ended up doing it because it had been several years by the time we got to that point. And I was like, it's not happening. And then I knew in the back of my head that I probably had endometriosis. That was always the suspicion, but everyone kind of just brushed it aside because I didn't have any symptoms, not anymore. For since my mid to late 20s, I didn't have any symptoms. And by the time I went in to do all the fertility stuff, I was in my mid to late 30s. So it'd been like a good solid 10 years of no symptoms. So they figured everything was fine. And I actually had gone in to see a surgeon before doing all of the fertility stuff to talk to him to see if we needed to do anything. He was like, I highly suggest we don't. Like, we're not even going to touch that. So, yeah, I guess it's multiple reasons why.
Yeah, and I hear that, and I'm sure you do too in your work, right? Like that, it feels like something that should just happen, right? Fertility, and yet, like I think feel like you knew in the back of your mind that, like with that endometriosis diagnosis or pending endometriosis diagnosis, like
Mhm.
we see that so often in women that their their past health story actually is part of their fertility conversation, and yet when you step foot into a fertility clinic, they're not often asking you about all of those historical moments in your health that maybe would
Mhm.
help guide those treatments that they
Mhm.
offer you, right?
Yeah. And then in this case, I can see where they came from as well, where it had been so long. They just figured, well, it was never officially diagnosed anyway, so you probably didn't have it to begin with. But we definitely know different from my surgical report. It was very messy in there.
And so, I mean, you walked us through kind of like those major medical moments of that whole story, right? The IUI, and then, I mean, you get sent home from the ER multiple times. But from an emotional perspective, I can't imagine that those couple of weeks of going back and forth were very easy. Like, what was your process like? Just in getting, I mean, I imagine you were getting like maybe more scared, but also stronger through those couple of weeks of being sent home and told nothing's wrong. Like, what was that experience like for you?
It's an interesting time. So it's a funny thing. Every time I speak to an endo patient, I slightly giggle whenever the comment comes out that, oh, I just thought it was normal. Like I just have a really high pain tolerance. And so going through my medical fiasco, I was basically told by multiple specialists that I have a broken pain scale because it it's not the same. It doesn't quite register the same way. And so I knew that things were getting bad when I had to be on like heavy duty meds. I was on hydromorphone IV drip for days on end, and it was working, but it would wear off, and I was in excruciating pain. So that was really scary, but I don't know. I guess I was just really, I'm also very logical. So my brain just kind of compartmentalizes stuff. And my husband likes to joke that I'm a bit of a robot when it comes to that. And I just process things. So I was very good at doing that while I was in the hospital and being able to just ask the doctors what was going on. I knew that we would eventually figure it out. I probably knew in the back of my head it was from the IUI, but I was really hoping I basically just had food poisoning, right? You kind of hope for the best, but in the back of your head, you kind of know what's going on. And there was a lot of fear, but I was also I knew I was in a good place. And there was also a lot of anxiety and almost grief because I knew that the IUI that we just had was not going to work out. So it's also navigating through all of that stuff as well at the same time. Um, it was a rough time, rough couple of months.
Yeah, I mean, there's stories where like it's almost unbelievable how quickly and then that's a procedure that gets done like routinely, right?
Yeah.
With reported pretty low risk. And I think when you're the one-off unique circumstance, I mean, that also is challenging because nobody's got their eyes open for like it's like you knew in the back of your mind it was probably from the IUI because you can see the time correlation. Okay, I was fine. I had this procedure that I was maybe a little hesitant about anyways, and now I'm not fine. But
Mhm.
those unique and rare side effects from a situation that our time to being able to figure that out often is longer than we want it to be or than it even needs to be.
I remember going through it and having so I was very lucky in where I was that my fertility team was tied in with the hospital. And so everybody was kept, like they were there every day to check in on me and have conversations with me. And I remember bringing it up a few times and they're like, honestly, my doctor happened to be the clinic director of the fertility clinic. And she said, in her 25 years of experience, this hasn't happened in her practice or all the other REs in her practice. So she said it's so unlikely that that's the case. And you just kind of go, oh, okay. If that's the case, then, we did happen to go out to a restaurant at the same time. So I figured food, but we even contacted public health about the restaurants we'd gone to see if anybody else had reported it. Like we went through everything with the hospital. And yeah, it's hard when you're the one off and you had to just constantly be trying to convince. I went through multiple departments at that hospital to try to figure out what was going on. And all of them were like, do you have an STI? Do you have this? Do you have this? I'm like, you can test. We literally just tested 2 days ago, but maybe. My husband even made a joke. He's like, how do you think she's going to get an STI? She can't even walk. Like, well, where is she going to get this STI in 3 days that she didn't have 3 days ago? So it was, yeah.
And so like now after going through that experience, like what does advocacy even mean to you now? Like you had to play such a huge role in your own health, right? Through that time to get what you needed and to persevere and be heard and all of those things. Like what does the word advocacy even mean at this point?
Um, I think it's so, so, so much more important to me now than it ever was before. I keep seeing it in different themes that come up over time with me. Started with when I originally I got my period at 12. So from my second cycle onwards, every single month, it was incredibly painful menstrual cycles. And I remembered speaking to my pediatrician about it, and he was like, "No, that's normal. Just take a Tylenol. It's fine. It's normal to have pain." And so I just thought it was normal to have pain. And I remembered for 4 days out of every month, pretty much, when I was in school, elementary school, high school, even university, I'd pull out of school 4 days a month, and was just always told it was normal. And I didn't think anything of it until I think it was more towards university when I transferred over, maybe at the end of high school, transferred over to a family doctor who was a female family doctor. She said, has anybody ever told you that this might be endometriosis? I was like, I have no idea what you're talking about. This is just normal. And that's when she then referred me off to a gynecologist. And I guess I started navigating through the system on my own a little bit with a little bit more support. But at the same time, the options I was given was birth control, surgery, or nothing. And when I chose nothing, I remember distinctly my gynecologist telling me, can you please come back to me as an OB patient because you have labor pain for 4 days every month. So you're going to be an awesome OB patient. And it was just kind of accepting that that was it and not really pushing and not really knowing to push was how everything kind of started. And then with all of this stuff with the fertility, and then in my own, clinical practice, seeing patients, seeing fertility patients, helping them kind of figure out what questions to ask and what things meant and going through all the details with them, you kind of realize that you need to really, because you're the one who has you're the only one, or you and your family are the only one who really, really care about what happens. And one of my patients in one of my previous clinics, who is a oncology patient, she kind of put it best. She said she had this huge conversation with her oncologist, and she said, if this works, if this works, this is great for you as your oncologist and is for me and my family. But if this doesn't work, it does nothing to you as an oncologist. It does everything to my family to devastate them. Right. So that's a very separate conversation, but I really like the way she put that, because it's like you and your family, you have everything to gain, but everything to lose. So advocating for yourself, for your health, whether it's endo or fertility or cancer, um, is so, so, so important. And so many people just they don't know how to navigate through. So it's important for them to kind of figure it out or have their support system around them to help them figure it out. I don't know if that answers the question.
It totally does. And I'm just being sensitive to the fact that where my cottage is, we have these airplanes that practice over the lake with their low level, no instruments, just like sightline flying. And once every couple of weeks, they fly over the lake, and they are doing it right now. And so
It's okay. My neighbor, if you can hear them, are renovating. They gutted their house. So
well, there
I
you
have
go.
some
We've got
noise over here to
perfect
compete with too. So that's fine.
So we might get a second airplane. They usually come in packs. We've had one so far. We might get a second one.
That's exciting.
But I mean, that story, Moira, like you're like from start to finish, right? You can see that, you have had to learn all of like, or you've had all these moments where there's been moments where advocacy was not, I'm not going to say it wasn't there, because I think probably in the back of your mind, you're going like, well, this doctor says it's normal. And I'm not sure that it is, but also it really makes you question yourself, right? When I'm going to call them like the authority figure that's in the situation, or the person who is supposed to have the most knowledge at the table, starts to sort of question your experience and your reality of the condition, right? It's like, I know we throw around the word gaslighting quite a bit right now online and in conversations around medicine, but in a way that's kind of what that is, right? Is downplaying that, even your monthly experience as a young woman, that it starts to make you think you're crazy, right? That
Mhm.
you're like, but I feel like this is different. I feel like the answer to this is still yet to be discovered. I don't feel like it's normal that I need to miss school 4 days per month. And yet that authority figure at the front of the room is saying that it is normal.
Mhm.
I like to think that in medicine, we're starting to move away from that like patriarchal kind of experience, right? Whether your doctor is male or female.
Mhm.
But that idea that like the person at the front of the room holds all the keys and all the answers. I'd like to think that we're moving away from that, where it's more patient-centered care. But there are still these moments where we make women question what's going on with their own bodies by downplaying their experience, or maybe only offering them 2 out of 6 options for their care. And your story, like through all those years, really like demonstrates like so many pain points that women experience in their fertility or gynecological journey. It's amazing that you got to this place where your story has this happy ending.
Mhm.
So let's flip and like talk a little bit about the patient side of things, because I always find it so fascinating when someone's personal story starts to inform their passion for their work. So I mean, I'm going to ask you like, why fertility, right? Like why do you work with patients in that realm. I mean, I'm sure after the last 20 minutes of talking, people can see why that this is such an important and passion, but still, like, there must be some draw there that even goes beyond your personal experience. What is that?
Yeah, ever since I was an intern at CCNM, so that's the college in Toronto for naturopathic medicine, I was always drawn to the fertility world. I loved working with fertility patients, whether it was just women coming in who were just starting to try or just interested in having that conversation, or women who had struggled. And I remembered my first fertility patient ever from the college. She had come in and I think she was 42 or 43 at the time. And she had had like a dozen miscarriages. And working together with her and my supervisor for the year, it was just so cool to see how to like pick through all the clues, I guess, to figure out what was going on. And I was so excited to hear that she had a baby after I graduated. She's pregnant, and we were so excited. And that kind of probably just ignited my interest and passion for it. And I'd always had an interest with women's health because of my history, and didn't really super focus on fertility for quite a while. It was part of it. It was definitely part of what I love to treat and women that I love to see. But it wasn't a primary focus until I don't even know how many years ago, where it was just all that I kind of put my attention towards. And that definitely, like with all of my stuff, definitely um, ramped that up significantly from when I started just struggle, as opposed to going through the IUI and everything. Um, just because I could see it from the patient side. I just found it, even though I work in the healthcare space and even though I work with women's health and fertility, I still felt so incredibly alone and just isolated, and like all the things that most of my patients will say to me, where it's like you feel like you're kind of broken and there's just something wrong, or maybe it wasn't meant to be. Like there's just all these things that float. And I don't know, just started working with more and more women, and they just kept coming because I think I just kind of put it out there that that's what I wanted. And that's kind of how I ended up here where we are today.
And how, like, do you feel like your style of practice, or maybe the way you approach those women, changed after your own experience? Like, was there a shift that came from like drawing on your experience for how you support patients now?
Definitely. I think I'm super open with our struggles and all the craziness that happened, because I think that the more people who talk about it, the more it becomes normal. And I remembered I had a friend who had a miscarriage before I was struggling, and she and I had so many talks, and she was saying how she felt so alone, but the moment she started telling her friends that she had a miscarriage was when she discovered how many people had had miscarriages in her life. And it was just such a weird topic that so many women go through but don't talk about. So I'm very open with sharing my story in the right moment. Like I'm not just jumping in there talking about me in my appointments. But I think that my patients really appreciate the fact um, that I get it. Like I get the struggle. I get that crazy, I don't even know how to explain it, roller coaster ride of emotions while you're struggling, all the highs and all the lows and all the hopes and all the like crushing like devastation that happens with every month. um I get it, and I think that they can see that I get it. And it's just trying to tell them, okay, there's things that we can do, there's things that we can do to support you, but also know that all these feelings that you're going through are so normal. Because I find that people just don't talk about it. It's getting better, but they just don't talk about it.
Yeah, this is such a good conversation and such an important one. I think it actually starts to like expand outside the conversation of fertility. But
Mhm.
what I like about talking about fertility is that it really showcases how important the story actually is, right? Like, I would say like the part of the infertility clues that we're looking for in a woman or couple's life is actually hidden in their story, right?
Mhm.
Their story that started maybe when they were 13 and their period arrived,
Mhm.
or when they hit 18 and went through, major developmental or growth changes or whatnot. Like the keys to understanding their fertility are often hidden in their story,
Mhm.
but we're just not set up that way medically for that to be, the showcase that it really should be as part of our understanding of a patient. It's so often that we push patients through procedures and attempts and cycles that are medicated that have a various degree of success, right? Like we get pretty excited and happy if something is 60% effective. I was like, well, what are we doing with all those other 40% of people who
Mhm.
didn't get pregnant, right? We're, that fertility care does require that more intimate, detailed and curious conversation with patients about their story, but we support it conventionally by giving everybody the same thing.
Well, we're also very fortunate as naturopaths that we have the time to spend with these patients to hear that story. Like if I were to sit down with you, like just telling my story, my medical history now is always like a massive conversation as opposed to before. And I don't think I would have had enough time to run through even half of the stuff, right? If it was just an irregular appointment. So we're super fortunate from a naturopathic standpoint to have that solid amount of time to sit down and hear that patient's story.
Absolutely. And it gives us way more understanding of what their like individual needs actually will be, right? And I think it's always why I've been so excited about treating fertility, because the evidence of what we can do is so great.
Mhm.
Um, we often end up meeting patients after they've had multiple losses or have spent years on their journey on their own. When I would certainly love, and I know you share the same sentiment, I would love to be part of a preconception plan for couples to help them figure out what their unique needs are. But when we
Mhm.
start to talk about that advocacy piece, I want to kind of circle back to that. Like, what questions should patients be asking about their fertility care that maybe they don't even know to ask? That, I mean, not just through your experience, but also through your knowledge as a clinician. Like, what should they be asking when they do sit down with their practitioner?
Yeah, so I usually I sit my patients down and I give them a bit of a strategy of like steps to kind of go through. So the first step I usually tell them is like always, always, always have copies of all of your blood work. Like whether it's obviously your fertility clinic is doing a whole bunch of stuff, but medical history wise, like always have a copy of any reports, any blood work results, surgical reports, anything, so that you have it with you to give to your whoever it is, your specialist. And on top of that, always know what your meds are, always know what your supplements are. And particularly if we're talking about women's health and fertility, be tracking your menstrual cycle data. And as a side note, because I used to use an app, I can't remember, I was like a BlackBerry person, like hardcore Black. Um, you will laugh at me. My current phone is my first iPhone, and I only got it because my son was born and about a year after he was born because I needed better photos. So I had a BlackBerry and I was using an app that was tied to the phone. And then when I update, anyways, I lost like years of menstrual tracking. That I was so sad. So make sure it's hooked to like your email so that you can just recover it all as a random side note tangent. But
All you
tracking,
BlackBerry user out there.
I know it's so
Gotta be
embarrassing.
one. Someone else is using a BlackBerry,
Okay,
but
okay.
there's just one.
um, but make sure you track your menstrual cycle, like at least bare minimum, know your day one, right, of every month. And if you can put in any extra data with like pain, like all your symptoms, if you can. And most of these apps will ask you all the things to kind of put in. If you just kind of check them off or click them or whatever it is, that's super, super important to go in with because it's really hard to remember how your menstrual cycles were this month, let alone last month and the last 3 months or 6 months, and to remember what happened and at what point and how severe was it and all the things. So everyone will, if you don't track, just assume, like when I first started practicing and I would ask women, well, when was your last period? I don't know. Let me take a look at a calendar, like maybe 2 weeks ago, maybe 3 weeks ago. Nobody tracked. We had phones, but we weren't really using phones like we do now, which
No, people would be
hopefully,
thinking, they're like, I remember that I had my period when I went out for lunch with my
yeah,
girlfriends. And
exactly. And then you'd have to figure it out.
so, yeah, that's how people track their cycle.
Yeah. And so now I'm always so excited every time I talk to patients and they're like, and I have all this data for you. I'm like, great. Can you please give me that data? Because it's so helpful from a practitioner standpoint to figure out what's going on. And then the next thing I kind of actually like it when patients um, have an idea of what's going on with their medical condition. So go in like knowing what your conditions possibly are, knowing what symptoms of that condition you have, knowing from a diagnosis standpoint, maybe at least some sort of idea of do they help you with blood work? Do they help you with an ultrasound? Like what helps them figure out if you have it or not? And then in general, know what type of treatments your doctor would be recommending so that you can then be like, okay, well, what about this? What about this? So that you can be it's much more of a collaborative relationship with your doctor. I am a list person. So I tell patients, write it down. And with our phones, it's just so easy to just pull out your phone, have a running email, have a running note, whatever it is. Just have your list of questions as they pop into your head. Because I don't know about you, but whenever questions pop into my head, it's like at the most random times. And so if I just wait, I'm going to forget. And if I think that I'm going to remember when I sit there and at that appointment, it never happens. So if you just have a running list of it and just don't forget to bring it with you. So if it's in your phone, chances are you'll bring it with you. Bring it with you and ask them. Those are like the things that I always tell my patients. These are the steps that you should go through to ask. And then when it comes to the specific questions, I guess I kind of alluded to it. It's like, well, what do you think I have? Like, what do you think is the problem? And what are the things that the other conditions that you might be considering to rule in, rule out? How do we do that? When do we do that? Like, what are the tests that we're going to run? From a referral standpoint, like, do I need a referral now? Can we just start that referral process now instead of waiting a few months down the line to then wait another 6 months? Like, just start all the referral processes as soon as possible. If you suspect that that's the case, like having that open conversation with your doctor is super helpful. And then also talking about the treatments and the other treatment options and the risks and the benefits and symptoms that or side effects that you might experience. I mean, that's a big thing for me now is like, okay, what can go wrong? Because when stats are thrown at me, stats are now out the door in my head because I'm like, what was it? I think it was, I don't even remember what the number was in research terms, but I remember calculating it into a percentage and my percentage risk was 0.016%. So that's pretty small. Not like lottery ticket small, but pretty small. And it still happened. So I want to know what those risks are so that I know to look out for them. Those are probably the gist of the questions that I would ask instead of, what is it? That's a lot of times those are the questions, right? What is it? What do you want me to do about it? Like as in treatment wise. And then you walk away versus talking about all the different options and all the different considerations, which is probably floating through your doctor's head anyways. But it's just a matter of vocalizing it so that you feel more educated about it and empowered and having some say into trying to figure it out and maybe some contribution to it to say, oh yeah, no, I don't think I have that because of this, this, and this, or I don't have any of those symptoms. I don't think that's the case. Or here's my blood work. It rules certain things out.
That I feel like that's gold. That whole list of things that you just mentioned there. I feel like that's for all those women that are listening. You're going to need to rewind and go listen to all of those questions again. But the idea is that we want, and this is really when I think about the bigger goals of the podcast and even the work we do, women in things like the Wild Collective, Women's Health Program. It's really about raising people's baseline knowledge about their health so that they can have a bigger, take up more space in that conversation, essentially. I mean, I certainly with the internet, you can find lots of maybe not so accurate information about your health conditions, which I think there's got to be a sort of a balance between all of that. But having some of that sort of basic understanding when you sit down to have those conversations, that it really helps you be able to make a much more informed decision. Because it's one thing to know what it is, but to ask the question of, well, how do we know what it isn't?
Mhm.
Right? That's missing, I think, from most conversations around health, because as the practitioners, we're like, oh, we know it's X, right? But
Mhm.
what we're not doing is having a conversation with the patient about, how do we know it's not these three other things?
Yeah, I didn't realize, because it's hard to step out of your own life and brain and all that stuff. And I have been entrenched in the science and health world for the majority of my life that I didn't even think about it when I ask these questions as I go. And when it really hit home was when I was actually in the hospital for those few weeks that I was actually in a ward. And I always had a roommate going in and out because I was constantly there and they were able to leave, which was super fun. But I remember multiple roommates were asking me, they're like, how do you get your doctors to stay and talk to you for like 20 minutes? My doctor comes in for like a minute, like as they're doing rounds, as they just kind of check in. And I was like, what are you talking about? And then when I started to pay attention and listen to their questions versus my questions, that's when I realized that there was a huge difference. Um, and that kind of snowballs into how to collaborate with your doctors and how to figure stuff out and how to feel a little bit more in control, even though things are completely out of control. And the questions that I noticed that they were asking when we were at the hospital, literally, it's like three questions. What do I have? How bad is it? When can I leave? Like those were pretty much all the questions they asked, whereas I had a lot more questions to ask. A lot. And I also I noticed that my roommates would have no idea what their day at the hospital was going to be like. Whereas I was like, oh yeah, I know today I'm going in for an ultrasound. Today I'm getting a CT scan. Today they have to do blood work. This is when the blood work comes back. And I will always ask, like, okay, what's the results? And that passes the time when you're in the hospital a lot better too, knowing that it's not just this endless amount of waiting. Um, it is a lot of waiting because you're waiting on test results, but knowing there's like a next step, next step, next step. Whereas a lot of my roommates just were like, I have no idea why I'm still here. And I'm sure a lot of people who are going through the medical system, whether it's fertility or anything, everything, will kind of feel the same way when they're in the hospital. It's just like, why am I just lying here?
Mm-hmm. Mm-hmm.
Kind of a bit more involved with it. And if you ask the right questions, they will tell you all the things that they're trying to rule in, rule out, and how they're doing it and why things are waiting, right?
Mm-hmm. It's so smart, because you're right that feeling like it's almost like pain with purpose, right? Like if you know it takes 7 hours for a test result to come back, then suddenly you're a lot more patient in those
Mm-hmm.
7 hours. And similarly, when we're talking to patients about when to expect to get better, right? Like really, we just need to be having much more open conversations about outcomes and efficacy and thought process, and create that more sort of patient-centered experience around that healthcare conversation. I wonder, and I'm curious what your thoughts are on this, Moira. Like, I think, because even as sometimes as practitioners, we can get our feathers ruffled a little bit when we get asked lots of questions. And I've tried to figure this out for myself. Like, what questions am I totally excited and happy to answer versus the questions that are like a huge thorn in my side as a practitioner. And I've tried to figure that out for myself so that I could be a little bit more reflective on those thorny questions to, be more empathetic or more patient when they come. And I think the style of questions that I struggle with, and I imagine that the medical doctors feel the same way, is when patients have looked up like some really like out of left field treatment options that are not available, not well researched. Like that, I find that really difficult when those kinds of questions get asked to me, or when I've presented an option and patients have Googled and found in a mouse one time, that particular herb made that mouse throw up and now they don't want to take it. I find those questions challenging as a practitioner, whereas the questions about like, Jordan, what are your thought processes behind my diagnostic strategy here? Like those, I'll talk for hours. But those other questions are, and I don't know how to draw the line in between what is a well-informed patient versus a patient who spent a billion hours looking up biohacking strategies for their medical condition. Like, what are
Mhm.
your thoughts on all of that?
Oh, that's a really hard one because I can see it from both sides. Because as a practitioner, there are certain questions where you're like, but my education, my clinical experience, and my ability to look into the research shows me that that's not the case, right? And then from the patient side, if I try to put myself in the patient side of things, because they just want to they just want a result. They just want to fix it. And I feel like part of it is they never have enough time to have those huge conversations with their health team, whoever that may be. And maybe things like the Wild Collective and all these programs, it's a lot more helpful, I think, for women to understand what's actually going on in order to then maybe not necessarily need to ask those questions. But at the same time, yeah, I can see it from the patient standpoint where they're so desperate to figure out what's going on with them because they know there's something wrong, but
Mhm.
everybody has told them that there's nothing wrong with them, that anything sounds better than nothing because that there's something wrong. Um, it's a really, like you said, it's a fine line. I don't have an answer for that one.
No, I just think it's
It's
a
really
cool
hard.
conversation. It is a hard one because I also like I'm getting softer in a good way in my years where I have started to see those kinds of questions as being the patient's looking for hope when hope has not
Yeah.
been particularly present for them, right? So of
Mhm.
course they're looking for like an off-label veterinary medicine that we might be able to use to cure their rare disease. Of course, they're looking for those kinds of answers, or they've ordered a point of sale test that has not been approved by the FDA, but they're going to do it anyways. And like, of course, right? They know that they deserve better in their health, but they're not getting it. But we also have to have those conversations around where does your health information come from, right?
Mhm.
Who wrote that blog and
Mhm.
what's their role in, are they the ones selling the off-label veterinary medication that they, have shown
Yeah.
is going to cure everything? So I do think that, you know, I love this conversation around advocacy. I think it has to happen on beside a conversation around like good just like information literacy, right? I always
Mhm.
use the example we like gave my parents the internet and they don't know how to critically appraise whether or not something is accurate or not.
Mhm.
And that's the same for all people, right? If you don't have a background in health education or health and science, suddenly like Gwyneth Paltrow doesn't look so crazy, right? Because maybe she's written a really compelling argument for why,
Mhm.
we need to put lemon everywhere or do whatever it is that she's talking about. So I think it's kind of a neat, sort of bigger question. Like, how do we create not just like well-informed patients, but patients that have the ability to ask good questions, have good information? I guess that's what we're trying to do here, right?
Yeah, I know. I feel like I always have this running list that just keeps getting added to of things that I wish we would teach kids from the get-go, like budgeting and nutrition and their menstrual cycles, and then yeah, critical thinking. Yeah, there's a huge list of things, I think.
That's what we need to do. We need to get it in the grade one curriculum
There
for
we
how
go. We
to.
need to work with the education system. This is where we're going next.
But I think by bringing that up is that because I'm sure some of our listeners are going, well, I try asking my doctor questions and I get shut down, right? Or I try asking my doctor questions and he seems irritated by my question.
Mhm.
And it's I think when that happens, that reflection is maybe the setup for this appointment actually isn't so that I can ask questions, which that's why we thrive, right? That's why naturopathic doctors thrive,
Mm.
because we do have the time. And if they've got one foot out the door and you're like, whoa, walk me through your, decision-making process for wanting to run my ferritin, they're going to be like, you just need it.
Yeah.
And so part of it is like the some of the brokenness of those systems where we don't
Mhm.
create space for those conversations. And so the irritation may come from that, but also the kinds of questions that we're asking as health consumers. That list that you gave is just brilliant, because that's that's helping you understand their process and decision making versus questioning it. Do you know what I mean? Like,
Mhm.
you're not saying no, you're wrong, I don't have endometriosis. What you're saying is, help me understand how you got here, because
Mhm.
that as a patient is going to help you feel a lot more confident in your treatment process when you deeply understand the how they got to that decision.
Yeah, it's the part where you're just more collaborating as opposed to just being confrontational, right?
Mhm.
Because nobody likes to be not that's what's the word? Not confronted, but you know what I mean. Um,
Challenged or
yeah, that's a
Mhm.
better word.
But it's kind of it's a neat conversation. So I think, like, as a consumer, like as a listener, if your reflection on asking your doctor some questions is bringing up some, like, crappy memories of you asking questions and then either not being answered or being dismissed, there's lots of possibilities for why that is, but also thinking about the kinds of questions that we're asking, and are they really going to help you get to where you want to go, when really all you want to know is, are we right? And what are my options? And what are the only question I was going to add to your list
Okay.
was, is there something I can do to help change how effective this is?
Yeah,
Right?
that's a good one.
Which is a great one, and that's really where we spend so much of our time as naturopaths, right? Is where it's like, yeah, you've been given the option of doing an IVF, but we've got 10 things we're going to do before that so that it's more effective. That's
Mhm.
a question that we often miss as a health consumer, is like, what's my role in the success of this? How can I help this process? Can I eat differently? What happens if I exercise? What happens if I sleep better? Those are the
Mhm.
kinds of questions that I also love to ask.
Mhm.
So as we kind of wrap up the conversation, Moira, like, I would love for you to share with us what your sort of big message is for women who are either on a fertility journey or just on a health journey in general. Like, what's your big sort of passionate message and mission for supporting patients in this realm? But also how we can get in touch with you, because I mean, you're one of our amazing practitioners at Clarity Health, and so there's that. But I also would love for them to connect with you online, and all of the other resources that you have to share.
Okay. My big mission, I guess, is I just want women to trust their gut and know that if something feels wrong, there's something to it. And they need to dig a little deeper with their healthcare team to figure out what's going on and build a good, solid team around them. Like when I was going through my stuff, I had my fertility, like my RE, my family doctor, all the specialists, but I also had a naturopath, I had an osteo, I had a massage therapist, I had a physio, I had a chiro, like I had everybody on my side. And I'm very fortunate that I work in this space to very easily figure that out. But having everybody working on you, but looking at you from different angles is super important, right? From kind of all the sides to figure it out and put all the pieces together. Um, and trusting your gut to know that you will figure it out and that you're not alone. There's so many people out there who have gone through the same thing, similar things, not the same thing, and have their own story and their own ability to support you, whether it's just from a friend or online or from a health standpoint. It's just important to build your team of people and your support system. I think that that's super important.
That's a great message.
Mhm.
And where can we find you?
Oh, right. Um, you can find me on Instagram. I'm Dr. Moira Kwok ND, and I have a website as well. And plus, I'm also at Clarity Health, so you can always give me a shout there. But my can we just leave it? Do you want me to?
Leave it. Yeah. Yeah. We can put it in the show notes. Thank you so much, Moira, for sharing your unique story. It's one of the advocacy is like the word of the moment that I've heard your story. I was like, holy, she's had to fight for herself, for the success of that IVF. You had to, everything about that journey shows that you are a total warrior. And I know that shows up in the way that you work with couples, right? There's nothing like someone who's walked the fire and then has turned back and helped other people do it too. I think that's such a powerful position for a practitioner to be in, to be able to share that vulnerable side, but also know that you have the science evidence-based background to help support all of those patients who are struggling with similar concerns. So thank you so much for sharing your story.
Thanks for having me.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.